We're joined now by Dan Ellsberg, the author of Doomsday Machine, Confessions of a Nuclear War Planner. Thank you for talking with us.
Thank you, glad to be here.
You've spent your career looking at the dangers of nuclear weapons, although not a public health threat when you think of day-to-day, but certainly the potential for long-term effects. What are some areas public health officials can do to make our world safer?
They should recognize that the very risk of nuclear war poses a danger to public health in the world that has never been possible more than half a century ago in all of human history. Even a single explosion on one large city would be a catastrophe that we've never seen. The smallest of nuclear wars, say with North Korea, would mean millions of dead, millions more injured. In South Korea, our allies, in Japan as well as North Korea, and possibly the US. More deaths in a day and a week and a month than has ever occurred in human history. Even that would allow for some input of public health officials and to take care of it over time. But the US and Russia each have huge systems of nuclear weapons posed against each other on a hair trigger for launch on warning, so that intercontinental ballistic missiles, ICBMs, can get off the ground before they're attacked. So they're on constant alert, constant warning, and there have been a number of false alarms. Each one of those would hit hundreds of cities as well as other military targets, and the smoke from that would cover the world and create an ice age on the surface of the Earth, and would kill all harvests worldwide, southern hemisphere as well as northern. Nearly everyone would starve to death. So the public health implications during those months of dying out would be almost unimaginable.
Such a horrible thought. Dan, you're obviously an advocate for shining more light on the work of government. Are there areas within the health infrastructure that you think we should have more information about?
Strictly speaking, the information that the public needs is that while our leaders, both in the US and Russia, threaten first use, initiating nuclear war, what they're threatening and preparing for is a public health catastrophe from which there's no remedy. The public health people need to understand and to communicate to the public what Physicians for Social Responsibility has been saying for quite a long time, that this is a public health challenge that cannot be met after the event. It can only be prevented. And that requires taking these weapons off hair trigger, reducing them enormously, down perhaps to the level of North Korea as a first step right now that would not threaten nuclear winter. So this is the message then for the public health people, is to make people realize prevention is everything here. We're talking about something that cannot be remedied once it's occurred.
APHA has as its mission to create the healthiest nation in one generation. What do you think are the two or maybe three most important areas for us to focus our energy on? Well,
I've talked about nuclear winter and nuclear war policies which continue, but climate change is another one, ignored, by the way, totally ignored with this nuclear winter, nuclear problems, but climate pretty much ignored in the recent campaign. And again, we're talking now about policies that allow CO2 into the atmosphere, affecting the environment against human survival, hour by hour as it goes on. It's not just a risk of a danger like nuclear weapons eventually. So to maintain even an unhealthy nation, but certainly a healthier nation, physicians, public health officials need to understand, like everyone, that public policy here threatens public human health on a scale we've never confronted before. We have to rise to that challenge in a way that humans never have yet done.
Thank you so much for talking with us. Really good information.
Thank you.
APHA TV has more exclusive content you can check out by clicking on the links to the right. Be sure to check back each day for brand new interviews, stories, and more from the conference. You can revisit past years of APHA TV by visiting our channel.